Triglycerides are a type of fat, lipid, found in your blood. Triglycerides are an important measure of general health. Elevated levels of triglycerides in the blood are called hypertriglyceridemia. Hypertriglyceridemia is a common clinical condition in adults. Normal levels of triglycerides in the blood are less than 150 mg per deciliter. We classify fasting levels from 150 to 499 mg per deciliter as moderate hypertriglyceridemia. Moderate to severe hypertriglyceridemia is levels between 500 to 999. Levels above 1000 is severe hypertriglyceridemia. High triglycerides may contribute to the hardening of the arteries. This increases the risk of stroke, heart attack, and heart disease. Pancreatitis is inflammation of the pancreas. The pancreas is a long, flat gland tucked behind the stomach in the upper abdomen. High triglycerides in the blood are a cause of pancreatitis. The risk of acute pancreatitis increases progressively with serum TG levels over 500 mg per deciliter. Here we will be discussing the causes of high triglycerides in the blood. Junk food is a common cause of high triglycerides. Unhealthy food contains saturated fatty acids and sugars. These saturated fats and sugars can raise triglyceride levels. Some examples are fried foods, red meat, chicken skin, egg yolks, high-fat dairy, butter, lard, shortening, margarine, and fast food. People who are overweight or obese often have higher than normal levels of triglycerides. Physical activity and exercise can reduce triglycerides by up to 30%. Whereas physical inactivity leads to a buildup of triglycerides in the blood. When you drink alcohol, it's broken down and rebuilt into triglycerides and cholesterol in the liver. So, drinking alcohol raises the triglycerides and cholesterol in your blood. Smoking is also another known risk factor for diabetes and high serum triglyceride. Too much glucose in your bloodstream is diabetes. It's common to have high triglyceride levels if you have diabetes. Low levels of thyroid hormones are called hypothyroidism. Hypothyroidism is also linked with too high levels of triglycerides. Kidney diseases such as CKD are accompanied by high triglycerides. Sometimes high triglycerides are a side effect of taking certain medications, such as diuretics, hormones, steroids, beta blockers, some HIV medications. Pregnancy can temporarily raise triglyceride levels. Women are more likely to get high triglycerides if they take birth control pills that include estrogen. Certain rare genetic conditions affect how your body converts fat to energy. Thereby they lead to high triglycerides. Consult your doctor for the best advice regarding high triglycerides. In summary, most common causes of high triglycerides are obesity, physical inactivity, unhealthy diet, alcohol consumption, smoking, diabetes, kidney diseases, hypothyroidism, medications, pregnancy, birth control pills. Genetic factors.